A 32-year-old woman experienced a worrying symptom, a persistent pain in her flank. The pain was sharp at times, a dull ache at others. It was localized to one side, just below her ribs and above her hip. Aside from the pain, she felt relatively well, going about her daily routine with minimal disruption. However, the pain was persistent enough to cause concern. She hoped it would resolve on its own, attributing it to muscle strain or overexertion. Days passed and the pain remained, a nagging reminder that something wasn't quite right. Along with the flank pain, she noticed a slight fever. The fever wasn't high enough to confine her to bed, but she felt warmer than usual, especially in the evenings. This combination of symptoms, the persistent flank pain and the low-grade fever, prompted her to consider seeking medical advice. She wondered if she had pulled a muscle during her usual exercise routine or perhaps contracted a minor infection. As days turned into a week, her condition didn't improve. Instead, the flank pain intensified, becoming a constant presence. The fever, once low-grade and intermittent, became more persistent, spiking higher in the evenings. She started feeling increasingly fatigued, her energy levels plummeting. Simple tasks that were once effortless now left her feeling drained and short of breath. Adding to her woes, she developed new symptoms, nausea and vomiting. The nausea came in waves, making it difficult to keep food down. She tried to stay hydrated, but even sipping water proved challenging. The vomiting, though infrequent, was forceful, and left her feeling weak and dehydrated. The combination of these new symptoms, coupled with the worsening pain and fever, painted a concerning picture. It was clear that this was more than just a pulled muscle or a passing bug. Unable to ignore her deteriorating health any longer, she decided to seek medical attention. She visited an urgent care clinic, hoping to get some answers and relief. At the clinic, she described her symptoms to the doctor, detailing the progression of her illness over the past 2 weeks. The doctor examined her, noting her elevated heart rate, the tenderness in her flank area, and her overall look of discomfort. He ordered some basic blood tests and a urine test, looking for signs of infection or other abnormalities. The blood tests revealed that she had an elevated white blood cell count, a sign of infection. Her urine test also showed signs of infection, further supporting the doctor's suspicions. An X-ray of her chest revealed a concerning detail. She had fluid in her lungs, a condition known as pulmonary edema. This finding, coupled with her other symptoms, pointed towards a more serious condition. The doctor at the urgent care clinic, realizing the complexity of her case, referred her to the emergency room for further evaluation and management. At the emergency room, a team of doctors, including her primary care physician, reviewed her case. They considered her symptoms, the findings from the urgent care clinic, and ordered additional tests. A CT scan of her abdomen revealed the source of her illness, a kidney infection that had spread to her bloodstream, a condition known as sepsis. Sepsis is a life-threatening condition that requires prompt and aggressive treatment. She was immediately started on intravenous antibiotics to combat the infection. She was also given intravenous fluids to address her dehydration and medications to manage her pain and fever. Over the next few days, her condition gradually improved. The fever subsided, her nausea and vomiting eased, and she regained some of her lost energy. After a week of hospitalization, she was well enough to be discharged home with oral antibiotics to complete her course of treatment. This case highlights the importance of early recognition and treatment of infections. It also underscores the crucial role of collaboration among healthcare providers in diagnosing and managing complex cases. Early diagnosis and treatment of urinary tract infections are essential to prevent complications like sepsis. Simple measures like staying hydrated and practicing good hygiene can significantly reduce the risk of developing such infections.